Hi, good afternoon. My name is Toniell. I'm a nurse practitioner student with South University. I'm here today to go ahead and perform a head-to-toe assessment on my patient. So before I get started, I just want to say that I already washed my hands in order to prevent nosocomial infections. And with the permission from the patient, I went ahead and provided privacy for her. So good afternoon, how are you?
Good, yeah.
Good. May I know your name?
Amy Marrero.
Hi, Amy, how are you?
Good, thank you.
Thank you. So Amy does not appear to be in any sort of distress. I don't see excessive respiration rate. She looks well groomed and looks her age, and that is the expected finding. So a quick neurological assessment, Amy. May I please know your date of birth?
It's June 8th, 91.
Good. And do you know where you are today?
Yes, I'm at the doctor's office.
Okay. Can you tell me the day of the week?
It is Friday.
Thank you. So that is the expected finding. It looks, Amy looks to be alert, working on oriented times 3. Also, before coming into the examination room, we went ahead and took Amy's vital signs. We also had an opportunity to check her vision using the Snelling chart, and it looks like she was 20/20 on each eye, which was the corrected vision, and that was checking cranial nerve number 2. So to start with the head-to-toe assessment, Amy, I'm gonna go ahead and I'm gonna need to not only inspect, but I'm also gonna need to palpate and in different areas of your body. If you feel uncomfortable in any way, if you feel pain or tenderness, just let me know and I'll go ahead and reevaluate my assessment with you, okay?
Okay.
Awesome. So with the head-to-toe assessment, I'm gonna go ahead and inspect her head. So Amy looks to have a normal cephalic head. It looks symmetrical. All angles. I don't see any lumps on initial inspection, so I'm going to go ahead and try to inspect her scalp. Okay, no lumps, lesions. I don't see excessive dandruff. I also do not see any redness. I didn't see any flakiness. Her hair looks well distributed. I didn't see any excess oil, which is the expected finding. And now I'm going to go ahead and palpate her temporal arteries, okay? Okay, so her temporal arteries appear to be normal at pulsations 2+, which is the expected finding. Moving on to your ears, Amy. First thing I want to do is go ahead and inspect both your ears. Okay. So first of all, I'm looking for symmetry. I don't see any protrusions, lumps out of your external ears. I'm also going to go ahead and palpate your tragus, any pain or tenderness.
No.
Your lobules, your auricle, okay, no pain there.
No.
Also looking at the external ear canal, I don't see any sort of discharge coming out of the external ear canal. No erythema, no redness. So what we're going to do now, Amy, is we're going to go ahead and try to inspect your tympanic membrane, okay? For that, I'm going to be using the otoscope, and it might feel a little bit uncomfortable, but it shouldn't be too much. If you feel dizzy by any chance, just let me know. I'll go ahead and stop the examination, okay?
Okay.
Okay. So in the ear of an adult, what you want to do is you want to go ahead and pull the ear up, back and out. Okay. Thank you. That wasn't too bad, was it?
No.
Okay, good. So it looks like Amy has a normal tympanic membrane. It looks translucent with a pearly color. I didn't see any sort of perforations or excessive wax coming into the internal ear canal. I didn't see any bulginess or redness or erythema. So that is the expected finding of a tympanic membrane. Next thing we're going to do, Amy, is we're going to start checking your hearing for hearing loss. And the first test that we're going to do is called the Weber's test. So this is a simple test. It just checks for unilateral hearing loss. And for that, we're going to be using what we call a tuning fork. Okay? So what I'm going to do is I'm going to strike the tuning fork against my hand and I'll place it on top of your head. And you're going to let me know when you can no longer hear the sound, or if you can hear the sound more in one ear or the other, okay?
Okay. I'm hearing him.
Okay. So it looks like Amy has no unilateral hearing loss, and that is the expected finding. The next test we're going to do is called the Ryan test. This test checks for air conduction versus bone conduction hearing loss. So what I'm going to do in this test is I'm going to go ahead and vibrate the tuning fork again, but this time I'll go ahead and place it on the back of your ear and your mastoid bone. After that, we'll go ahead and move it lateral to your ear when you can no longer hear it anymore, and then we'll repeat the process. You're going to let me know when you can no longer hear it, okay?
Okay. Okay, I can't hear it.
Okay. So it looks like air conduction is twice as long as bone conduction, and that is the expected finding for the Ryan's test. The next test we're going to use is to check your cranial nerve number 8. I'm going to go ahead and occlude one of your ears and whisper a word on your other ear. You're going to go ahead and repeat it back to me, okay?
Friday.
Friday, good. Tuesday, perfect. So that's testing cranial nerve number 8, and it appears to be intact. Moving up to your eyes, Amy, I just want to look first of all at the symmetry of your eyes. Again, looking for any masses, any swelling, periorbital edema, any redness on your upper or lower eyelid. I'm also looking at your inner and your outer canthus for any discharge. So if you can do me a favor, look up. Okay. So looking at the conjunctiva there, it looks pink and moist, which is the expected finding. You do not appear to be anemic. I'm looking at your sclera also, and I don't see any signs and symptoms of jaundice in your sclera. So the next thing we're going to do is we're going to go ahead and check your pupils now, okay? Okay, so do me a favor, look forward and across my shoulder. Good. Okay, so it looks like both your pupils are constricting from a 4 millimeter to a 2 millimeter bilateral, and that is the expected finding. We call it perla, which is pupils are equal, round, and reacting to light and accommodation. Okay. Next thing we're going to do is we're going to check your peripheral and your central vision, and to do that we're going to be doing the cover test. So with your right hand, or whichever, I'm sorry, go ahead and cover your right eye first, okay? You're going to let me know when you see my fingers.
I see them. I see them. I see them.
Good. Now let's repeat the test with your other eye.
I see them. Yes.
Okay. So it looks like your visual fields are intact. Next test we're going to do is called the red reflex, and that's pretty much what we're doing there. Is we're looking for a clear reflection of the light against your retinas. Okay. So to do that, I'm going to need you to go ahead and once again look forward and across my shoulder, and this time, I'm going to go ahead and move lateral about 15 degrees from your midline. So look forward, and I just want to step away about 15 inches away from you, looking for a clear red reflex that does not show any shadows. Okay? So it's gotta be orangey without any specks or shadows or anything like that. So go ahead and look forward once again. Okay, good. So I was able to visualize the red reflex. Again, it was clear, no shadows, it looks orangey, which is the expected finding. Next thing we're gonna do is I'm gonna go ahead and try to visualize your optic disc. For that, I'm gonna have to get closer to you and look inside your eye there to hopefully visualize your optic disc. Okay. Do me a favor, look forward. Okay, good. Now we're gonna do the other eye. Are you okay?
Yes.
Okay. So it looks like your optic disc on both your eyes is well defined. I didn't see any sort of hemorrhages, so it looks like you have sharp margins, and that is the expected finding. Moving on to assessing what we call the extraocular movement, and that's checking for cranial nerve number 3, 4, and 6. What we're gonna do in this test is we're gonna use the 6 cardinal fields of gaze. So what I need you to do is, without moving your head, you're gonna follow my fingers with just your eyes, okay? So starting from the midline. Look up. Yeah. Good. So no nystagmus is noted, and it looks like cranial nerve number 3, 4, and 6 appear to be intact. Moving on to your nose, just inspection of the nose first. So it looks like you have a symmetrical nose with no lumps or lesions and no scars. Go ahead and breathe for me. The other one. So patency of each snare is intact. I'm gonna go ahead and try to inspect now your nasal mucosa. Okay. See a mucosa that is pink, moist. I didn't see any discharge out of your nose. No deviated septum, which is also an expected finding. So right now we're gonna go ahead and check what we call cranial nerve number 1. That's your olfactory nerve. So I need you to close your eyes and let me know what you smell, okay?
Alcohol.
Alcohol, good. So cranial nerve number 1 appears to be intact. The next thing we want to do is go ahead and inspect your sinuses. So starting with your frontal sinus and then moving down to your maxillary sinus. I don't see any swelliness or puffiness. Let me know if you feel pain, okay? Any pain?
No.
Okay. So maxillary or frontal sinuses do not show any tenderness. Next thing we're going to do is we're going to check cranial nerve number 5. We're going to be checking for sensation, so pain and sort of pain or soft. You're going to go ahead and tell me what you feel. Once you close your eyes, I'm going to be touching your face, okay? So go ahead and close your eyes. Does it feel soft or painful?
Soft. 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 Soft.
Okay.
Pain. Pain. Pain.
Okay, good. So cranial nerve number 5 appears to be intact. Next, moving on, we're going to check your facial nerve, cranial nerve number 7. To do that, I'm going to need you to open and clench your jaw. Good, okay. Now frown your eyes. Open them wide. Good. Puff your cheeks. Good. That's cranial nerve number 5. Moving on to cranial nerve number, cranial nerve number 7. I apologize. Moving on to your gag reflex. Okay. Give me 1 second. I'm only putting gloves because we're gonna look inside your oral mucosa in a little bit. So. So let's check your gut reflex, open wide.
Ah.
Okay, so it looks like gut reflex appears to be intact, and that's cranial nerve number 9. Next thing we're gonna do is, I need you to stick your tongue out and move it side to side. Okay, touch your hard palate. Good, so that's cranial nerve number 12, and it appears to be intact. Next thing we're gonna do is we're gonna try to inspect your oral mucosa, so without sticking your tongue out, go ahead and just open your mouth. So oral mucosa looks pink and moist. Go ahead and say ah for me. Stick your tongue out. Ah again. Repeat it. Okay. So the uvula is moving up and down with no deviation, and your tonsils appear to be 2+. I did see a pink and moist oral mucosa with no swellingness, no bleeding of the gums, and I didn't see any dental caries, any patches under the tongue. Or any other lesion that we should be worrying about. Okay. Moving on to your neck. Again, just inspecting your neck. Any protrusions of the neck, any lumps, masses. I don't see anything. I'm gonna go ahead and look in the back. Okay, nothing in the back. And I'm gonna start assessing your lymph nodes. So to start with your lymph nodes, I'm gonna start with the preauricular lymph node, postauricular, occipital at the base of the skull, tonsillar, submandibular, submental, posterior cervical, anterior cervical, and supraclavicular. Any tenderness or pain?
No.
I didn't notice any swelling either, which is the expected finding. Next thing we're going to do is go ahead and palpate the TMJ, the temporomandibular joint. Go ahead and say and open and close your mouth multiple times. Thank you. Any tenderness or pain?
No.
We're also looking for a clicking sound on that, and it looks like she has no signs and symptoms of crepitus. Next thing we're going to do is we're going to go ahead and check your neck for bruits or carotid bruits. In order for me to do that, I'm going to go ahead and turn my stethoscope from the diaphragm to the belt. Okay. Take a deep breath and hold. Hold. Release. Okay. Let's do the same with the other side. Thank you. So it looks like no bruises were noted, and that if they were present, that is a sign of turbulent blood flow, but none were present on this patient. Your trachea looks to be midline, and I don't see any deviation of it. And right now I'm going to go ahead and try to inspect your thyroid for any masses. So go ahead and look forward, lift your neck a little bit, and swallow. Okay, one more time. So upon inspection, I didn't see any masses of your thyroid. I'm going to go ahead and try to palpate it. Okay. So in order for me to palpate the thyroid, I'm going to need the patient to move forward her neck a little bit and to the left Okay. And swallow for me. Again. Okay. Now let's repeat to the other side. Swallow. Okay. So no masses or goiters were found upon palpation, which is the expected finding. Moving on, Amy, we're going to check what we call jugular vein distension, okay? In order for me to do that, I'm going to need you to go ahead and recline back. I'm sorry, lift up a little bit. And for this, I'm placing the head of the bed at 30 degrees, which is the angle that we need to use to inspect the jugular vein distension. Okay. Okay, just turn your head to the left a little bit. So Amy, thank you. Go ahead and put back. So Amy looks like she has no distended pulsation, which she has no jugular vein distension, which is the expected finding. Moving down, to her posterior thorax with inspection. I don't see any scoliosis or asymmetry of the posterior thorax. I'm gonna go ahead and palpate. Say for me 99.
99.
99.
99.
99.
99.
99.
99.
Okay. So bilateral vibrations appear to be equal for tactile fremitus, which is the expected finding. Right now I'm going to go ahead and percuss the posterior thorax, so starting from the top. So always avoiding the scapulas and from side to side comparing. So it looks like on percussion, all lung fields appear to be resonant. I'm going to go ahead and try to auscultate lung fields. To do that, I'm going to start from the base, trying to listen for any crackles. So breathe for me. Exhale. Again. Again. So it looks like posterior breath sounds are equal on both sides with no areas of consolidation. Okay, Amy, do me a favor and recline back for me. Thank you. So right now I'm going to go ahead and inspect your anterior thorax. I don't see any dissymmetry, any lumps, any masses. I'm going to go ahead and palpate for tactile firmness. So go ahead and say 99 for me.
99.
99.
99.
99. 99.
99. 99.
Okay. So it looks like bilateral vibrations are equal on the anterior field. I'm going to go ahead and percuss. Okay. So resonance upon percussion on all lung fields. This time I'm going to go ahead and try auscultate. I'm going to start from the apex of the lungs and moving down. Take a deep breath from me. Again. Again. So all lung sounds are clear on all lung fields. Moving on to auscultation of heart sounds, I want to start with the aortic, moving to pulmonic, and then tricuspid and mitral valve, mid-clavicular line, fifth intercostal space. Okay, it looks like S1 or S2 are present. I didn't find any murmurs, S3 or S4. And I was able to go ahead and auscultate all valves. Moving to, if I wanted to go, I'm not going to do it for the purpose of the time that we have for the video, but if I wanted to go ahead and palpate the PMI, I would have asked the patient to go ahead and move to the left lateral, the cubitus position. That's usually where you can palpate the PMI or the point of maximal impulse for the patient. So right now, Amy, I'm going to go ahead and inspect your abdomen. With your permission, I'm going to go ahead and lift your shirt a little bit, okay? So that you feel comfortable, you can either put your hands on your chest or you can put them to the side, whatever you decide, okay? So inspection of the abdomen looks like she has a flat, non-bulgy abdomen. So it is, I don't see any masses or lesions anywhere. So what I'm going to do now is go ahead and auscultate the quadrants of the abdomen, starting from the right lower quadrant. So it looks like Amy has active bowel sounds, and they should be around 5 to 35 per minute, and it looks like she is normal with her bowel sounds. Moving on to percussion of the abdomen. So it looks like her abdomen is tympanic to percussion. Any changes to dullness will be either on the left upper quadrant or the right upper quadrant with the liver and the spleen or any other masses or abnormalities. But the normal sound is tympanic. Moving to light palpation. Just feeling for the skin, any superficial masses, changes in the face of the patient with tenderness or pain. Okay. Go ahead and take a deep breath for me. Exhale. Okay. I wasn't able to palpate the liver. And any pain or tenderness?
No.
Okay. And the spleen is usually non-palpable unless it's enlarged or it has splenomegaly. Okay. So next thing we're going to do, and it's go ahead and auscultate for bruits of the aortic. The renal on each side. And then the iliac arteries on each side as well. Okay. So no bruises were noted. Okay. Moving on to palpation of the inguinal nodes for tenderness or pain. Any pain, Amy?
No.
No pain at all. Okay. Thank you. So go ahead and do me a favor and go back up for me. Appreciate it. So right now I'm just going to have a quick inspection of her skin. Her skin looks to be soft, warm, and dry. Temperature appears to be equal bilateral, which is the expected finding. I'm going to go ahead and check her nails. In this patient, I'm unable to go ahead and assess capillary refill. She has painted nails, but in a normal person should be brisk in less than 2 seconds. She does not have clubbing of the nails, which is the expected finding. Moving on to her pulse sites, I'm going to start with the temporal. both sides. And moving to her carotid. Just one side, not including both at the same time. Brachial. Radial. Femoral. Popliteal. Go ahead and lift your knees a little bit. Posterior tibial. And dorsalis pedis. Okay. So her pulses appear to be 2+ of equal rhythm and rate bilateral. Moving on to range of motion, Amy, and we're going to go ahead and assess range of motion of your right shoulder first. So go ahead and move your arm over your shoulder like this. Okay, now repeat with your left arm. Okay, very good. So extend your arms out. Okay, and I'm going to apply some resistance. Good. Now go ahead and apply some resistance to me. Good. So go ahead and let's do the shoulder shrug. Okay. Bring it down. Bring it down. Good. Repeat. Bring it down. Good. So strength, the shoulder shrug is cranial nerve number 11, and that appears to be intact. And strength appears to be equal bilateral at 5+. Moving to reflexes. To check the reflexes, we're gonna use the hammer. The hammer, and we're gonna start checking. First of all, we're gonna go ahead and check the bicep reflex. So just relax your arm. Okay. Let's do your. I'm gonna go ahead and lift it up a little bit. Okay. I'm gonna do your tricep reflex. Okay. Good. Moving to your patellar reflex. Okay. Now we're going to check your brachial reflex. Okay, good. And then finally your Achilles reflex. Okay, good. So all reflex appear to have a quick response at 2+. Moving to her lower extremities, I don't see any sort of deformities or any lumps, anything to worry about. We're going to go ahead and lay back for me, please. And we're going to check for flexion of the hip. So just relax your leg. Relax. Okay, good. Good. Any tenderness on your hip? No. Okay. So right now we're going to check for plantar flexion and extension. Okay. So ankle extension and flexion appears to be equal bilateral, equal strength with 5+. Go ahead and lift up for me. Thank you. So let's go ahead and assess her gait. So if you can, please, Amy, go ahead and walk towards the camera and come back. Okay, so she looks to have an even and steady gait, which is the expected finding. Now go ahead and do heel to toe. Okay, come back. Okay, good, perfect. Now stand with both your feet next to each other, completely next to each other, please. Thank you. Okay. Now close your eyes. Okay. So no excessive, thank you. No excessive swinging found, and it looks like the rumbles is negative. So a couple neuro checks, if you can just, you can go ahead and sit back up. First of all, we're going to start checking for rapid movement and coordination. So this is what I need you to do. I need you to get one hand and do this. Okay. Now you're going to alternate. Perfect. Now you're going to take your heel and run it down your shin with one leg first and then the other. Okay, now repeat the other. Okay, so it looks like rapid alternating movement and coordination appears to be intact. Moving on to what we call graphesthesia. I'm gonna need you to go ahead and close your eyes. And I'm gonna need you to identify what I'm drawing in your hand, okay? So just close your eyes.
A circle.
Okay, good, very good. The next test we're gonna use is called stereognosis. I'm gonna place something in your hand and you're gonna let me know what it is, okay?
A coin.
A coin, perfect. And the next thing we're gonna do is called point location. I need you to close your eyes and let me know what I'm touching you, okay?
My neck. My cheek. My arm. My right arm. My right leg. My left leg.
Okay, so thank you, Amy. That will conclude my head-to-toe assessment. Do you have any questions for me?
No, thank you so much.
Thank you for being a great patient. You have a wonderful rest of your afternoon. Thank you.
Thank you.